Stanford Hospital is reporting the most harm to patients to the California Department of Health with 54 adverse events. This covers the date range from July 2013 through June 2014. They are followed closely behind by Loma University Medical Center with 53 adverse events. Both hospitals are reporting a similar pattern to many hospitals in California. The majority of reported events are identified as stage 3 or 4 decubitus ulcers acquired after admission. This chart shows the preponderance of stage 3 or 4 decubitus ulcers acquired after admission being reported by both Stanford and Loma Linda. Retention of foreign objects in a patient is a far second. Factors that might explain why these two hospitals are reporting the highest number of adverse events might be due to them seeing more patients than most hospitals and thus having more opportunity for something to go wrong. Another possibility is that it might be due to them treating patients with more severe conditions than most hospitals. If an attempt is made to control for these factors, it might give a clearer picture. I'm going to use a proxy for hospital comparison on discharges and severity. Medicare releases the number of discharges for the top 100 MSDRGs by volume. A MSDRG is a classification of a patient's condition, like, say, pneumonia or congestive heart failure. In the file, Medicare identifies the hospital and the number of discharges by the top 100 MSDRGs. There are currently 751 different MSDRGs. The information is therefore a subset of all possible categories. This chart is a scatter plot. Each of the small round circles represents one hospital that has at least reported one case of an adverse outcome. The vertical axis shows the number of adverse outcomes reported, and the horizontal axis shows the number of the top 100 Medicare discharges. The two small lines represent the average. So what this is telling us is that both Stanford and Loma Linda are probably seeing more patients than the average hospital in California. This scatter plot shows the case mix index on the horizontal axis. The case mix index, or CMI, gives us some indication on how complex the cases are. So the average Medicare patient nationwide would be roughly 1.0. So anything higher than 1.0 would be considered higher than the national average. And both Stanford and Loma Linda have case mix indexes that are higher than the average California hospital. It appears that both Stanford and Loma Linda see both more patients and sicker patients than the average California hospital. However, that does not seem to explain away the greater number of adverse events that they have reported to the California Department of Health.